Dear friends and colleagues, I am extremely happy to introduce Journal of Psychosexual Health, an international journal published by Karnataka Sexual Sciences Academy and SAGE, one of the very renowned publishers. The impetus for starting this particular journal are manifold, and one of the important aspects is that sexuality is one of the most neglected area. Quacks and others are having the field day. Either medical professionals or the public are quite significantly ignorant in this particular field for the simple reason that this is not a subject matter which is taught regularly in the medical schools. And from that particular angle, we have decided that this particular Journal of Psychosexual Health should form the platform wherein all the scientists, researchers, clinicians, and each and everyone who is interested in this particular field participates, learns, and contributes to the advancement of sexuality and sexual medicine. There are varied reasons, again, to look into this particular matter a little more elaborately. One of the important components, as the title itself indicates, it is psychosexual health, to emphasize the point that biology, psychology, and sociology, all the three things interact in dealing with, or when we are trying to look at the cause, effect, management, all these three things need to be emphasized. At one particular point, quacks have hijacked all the field of sexual medicine for the simple reason that we have not taken the lead to educate or get involved with. And this is one of the reasons when we try to look at many of the specialties that have sprang up, whether we may be gynecology, surgical branches like urology, medical branches like internal medicine, dermatology, obstetrics and gynecology. Many of the times the focus is on a very limited area in the sense that what actually precisely the organic factor which is leading to the difficulty. We are all well aware the havoc, the hypertension, diabetes, other metabolic syndromes, and usage of drugs, either medical or psychiatric. Each of them have very deleterious effect or significant problems in the sexual functioning of an individual. And what we need to look at is actually to educate each and every field what we have just mentioned, to see that all of them look at this particular problem from a biopsychosocial perspective. Coming to psychology and psychiatrists, even this is again one of the areas we should have been one of the very prominent place in the curriculum is actually neglected. And this is one of the reasons why we need to look at almost all the nuances involved in the sexual medicine. The journal emphasizes the psychosexual health, but for all practical purposes, we are open to each and every field which is directly, indirectly related to this particular aspect. We will be trying to cover all the basic sciences related to it, socio-culturally speaking, anthropology, theology, sociology, and in the same breath, the medical, surgical, and related aspects, and how precisely we can synthesize all of these type of things. We are intending to keep it open access for the simple reason that this should be accessible to each and every individual, whether public or professional, and that way we want to contribute immensely to the advancement of this particular field. And we are almost always open for your suggestions. Be part of this particular venture, participate in each and every activity related to, and we look forward to, if you are interested to be part of the editorial team, most welcome. You please do write to us. If you want to be part of authorship, do submit your articles for this particular journal, and we assure you that as it stands now, this will be open access and available worldwide to each and every person. This will be gold open access in the sense that both authors and the public, they don't have to pay anything to this particular submissions and for the reading or going through the issue. We look forward to your very active participation and involvement in this great venture, and I wish you Happy New Year, happy reading, and we look forward to work as a family in this specialty field of sexuality, sexual medicine, and related areas. Thank you very much.